Hello, my name is Julia Rodriguez, and I am the healthcare reporter for the Rio Grande Guardian. Today, I am speaking with. Please introduce yourself.
Hi, I'm Ryan Dumott.
And what brought you here to the STHS Symposium today?
So I'm an acute care surgeon. I do trauma and critical care and general surgery. I'm a surgeon up in Dallas, Texas, and I'm here just to visit McAllen and learn a little bit about the health system down here in the Rio Grande Valley, and also see some friends and colleagues.
Do you think the Valley has a special need for better trauma care, or just?
Yeah, I think the importance is really highlighting what McAllen does down here and educating the community about how we take care of trauma patients, and whether that's in the pre-hospital environment, but also in the hospitals themselves.
And how did they recruit you to come speak at this event?
Yeah, that's a good question. So we have some networks of colleagues, really, through some national organizations and some professional organizations. And Dr. Carlos Palacio is a close colleague, and he invited me down to speak. And I was here last year, and fortunate enough to get an invitation to come again this year. So it's really nice to be here, and that's through those kind of networks that we usually get invited.
And is there anything else you'd like for the public to know or to add?
No, just that I think these kinds of events are so important because there's trauma takes a whole team, and so today we have pre-hospital EMS providers, we have nurses, advanced practice providers, as well as physicians, and so for everybody to work together and to learn about how to take care of these patients that can be incredibly complicated and incredibly sick is really important. So having these kinds of symposiums is such a perfect venue to be able to do that.
And my last question is, how do you think the Valley is doing in terms of trauma care?
Well, I think this is just the fact that you're even having these conversations and these symposiums. I mean, it's remarkable to be able to bring down a lot of surgeons from across the country. We had surgeons from New York, we had surgeons from Miami here, and all throughout the country. And so bringing them all here is a great way for your community to learn about that and learn how to take care of these trauma patients.
Great. Well, thank you so much for your time.
Of course.